Okay, so I am going to be doing the donning and doffing of PPE. So before we even put on anything at all, we are going to do what we will usually do when we go into a patient's room, which is we will go ahead and check their patient chart, also see if there are any orders or if there's any equipment that we need to be taking into these rooms, just because we can't be going in and out of the rooms and have that accessibility too much once you're in there. So also before we are doing this, we are also going to be washing our hands. So we're going to be performing good hand hygiene before doing this. Then we are going to put on or don on our PPE in a certain order. So we are going to start off with our head. Then we're going to go to our feet. We are going to don on our gown. We are going to be putting on our mask. Then we will be putting on our goggles because I'm wearing glasses, I'm just gonna go ahead and show that you would put on your goggles at this time. And lastly, we are going to be putting on our gloves. Okay, so once you're in there, you go ahead and you do whatever you need to do with the patient, perform any assessments or anything that you have to. And then once we come out, we are going to take this off and we are going to dispose of it in whatever way that our facility wants to dispose of this. It is also important to note that we have to look at the precautions on the doors, which they will have on there. So depending on what precaution the patient is on is also what we're going to be donning on. So we are going to be taking this off, and we're going to also take it off in an order. So we are going to start with our head and dispose of this. Booties. Then we're going to be taking our goggles and our mask off. Then we are going to be taking our gloves off, making sure that we do not touch the gloves from the outside. So, and just kind of ball it up inside out and dispose of those, and as well as taking our gown off and making sure that we do not make contact with the outside and pull our arms out and kind of roll it up like inside out, and we are going to dispose of that too. After we go ahead and don off all of our equipment, we are going to perform hand washing, and we should be good. Okay, so this is going to be the vital signs video. Before you enter the room, you're going to be checking the patient's chart to check for any medication that they are on, also for any orders that the doctor might have put in. Before entering the room, we will knock, and before even touching the patient, you will perform hand hygiene. So we are going to introduce ourselves. So my name is Jasmine. I'm with the Respiratory Therapy Department. I'm going to be taking your respirations and pulse. Can I have you state your name and birth date?
Andrew Schuster, November 14th, 1995.
Okay, so for pulse, we're going to be checking for a quality of pulse as well as rhythm. And for respirations, we're going to be checking for the depth of the respiration as well as the quality. And we're going to be checking for any signs of pursed lips, labored breathing, or anything abnormal like that. So I'm going to take your pulse. Okay, so for respirations, I got 4. We times that times 4, that's 16. For a pulse, I got 60. So after this, we would also check for the saturation of oxygen, which you would do with a pulse ox. You would also do a blood pressure. Before leaving the patient's room, make sure that the patient has everything that they need. Thank them for letting you assess them, and that is it. This is going to be the auscultation video. I'm going to auscultate 6 different places posteriorly, and then 1 on each side, and 6 different places on the anterior side. First, we're going to make sure that our stethoscope is clean from earpiece all the way to the bell, and we are also going to be checking to see if our stethoscope is working. Okay, so I'm going to start on the back, and I'm going to be going back and forth just to make sure that I can listen to his both lungs. So we are going to be just assessing to see if we hear any unusual sounds. Andrew does have asthma, so I did hear wheezing throughout the posterior side, lateral side, and anterior side.